Thank you very much, and thank you all for being here on a Saturday afternoon. I know that there are other pressing things to do today. So, my name's Matt Sawyer. I'm a GP. I live in North Yorkshire. I grew up in York itself, but I practice a little bit north. But I don't just do medicine. I also do work around the environment, particularly carbon emissions from primary care and carbon literacy training for staff. So actually, there's quite a lot of different health impacts from the climate crisis. And this is a chart that people may have seen elsewhere. It's been used quite widely. And really in the centre, it's got the rising temperatures, weather extremes and rising sea levels, and then starts to think about all of the different health impacts from each of those. But we're just going to have a look at very briefly at a few of them. So we'll look at the heat, we'll look at severe weather, and we'll have a look at air pollution. So really we can start to think about how is climate change and the climate crisis going to affect us here in and across Yorkshire. So this is a projection of sea level rise by 2050, and anything that is in red at the moment or on this is going to be below sea level. So although York itself may not appear on this, actually, when we start thinking about the number of people who live in the Humber Valley and on the floodplains, there are going to be a lot of people who are going to be rehoused and need to move home. So this is actually going to create some climate refugees and people who are going to be rehoused elsewhere. So this is actually a pretty huge area. Now, actually, this is a picture of me on my wedding day. This was a few years ago. This is up in Reeth. It was November, but we've got beautiful skies. And this was at the bottom of the valley 6 months later. This was where flooding had wiped out one of the bridges. And of course, delivering healthcare is very difficult if you don't have road access. So if we start thinking about, can patients get healthcare? Can doctors and nurses and health professionals deliver healthcare, it starts to become more of a problem. And these are actually some of the quotes from people at the time of how the flooding had affected them. People who had lost everything, people who emotionally and mentally felt that they were never going to be able to get over this, people who then felt that they had anxiety and almost a PTSD with every single time it rains. Now, of course, living in Yorkshire, it rains quite a lot, and you can imagine how much anxiety people will then suffer from. And this is actually the front page of the Mirror newspaper from Thursday, and this is a mock-up of what would be expected in the shambles in York, and how much of York itself is going to be underwater. Now, I mentioned, I touched on some of the mental health impacts of flooding, and really when you start talking to people, it is about loss, it's about distress, it's about breakdown of routine, breakdown of access to healthcare, breakdown of family and support units, it's about isolation, it's about fear. And certainly studies have shown that if people are flooded, then they are much more likely to have depression or anxiety or PTSD as a result. So the worse the climate gets, the worse that storm damage gets, the worse that the flooding is, the more ongoing mental health problems we will be enduring. So what about heat? Well, actually, a similar sort of latitude to York, Leeds. It said the climate could be a bit like Melbourne's in 2050. Doesn't that sound delightful? It is, until you realise that actually the Australians dread their long, hot summers. And certainly when you start thinking about some of the health impacts of heat, that the heat wave that happened in August 2020 had associated 1,700 deaths with it. We also know that people are more likely to turn up to accident and emergency departments, that the risks of dying from strokes and respiratory disease goes up with every single temperature rise, 1 degree C temperature rise. We also know that there's effects for the police because there's more physical violence with rising temperatures. We know that there's effects on the fire service in terms of fires. So actually all of the emergency services start to suffer and struggle. So that sounds a bit of doom and gloom, but actually, what could I do? What could we do to start trying to mitigate some of these things? Well, this is a thermal image of a hot day, and this shows the difference at the bottom of the screen in orange. This is the temperature without shade of 61 degrees, and the temperature in shade of 34 degrees. Now, both of those are high numbers, but actually the difference of having shade, the difference of having trees and having tree cover within towns and cities where we live is vast. So on the one hand, I'm delighted for tree planting and making forests and making woodlands, but actually I want tree planting in towns, cities and villages where people live and where people will benefit from it, because this is on an hourly and a daily basis for people. The next is just to touch on air pollution, and we know that long-term exposure to various gases affects lung function in children, respiratory infections, effects on adult lungs, dementia, glaucoma, and a whole host of other impacts. We know that it's responsible for worse educational attainment in children. So children who grow up next or go to school next to roads which have got a high degree of air pollution do worse in their exams, even when you take out all of the other factors. So air pollution has a huge impact. And actually, because this is York Environment Week, this is the map of York, and the bits in red are the places with particularly high levels of nitrogen oxides. The bits in dark orange are the ones that are almost as high. Note that there aren't any purples or blues or even greens on this map, apart from one small square outside of the ring road. So again, what could I do? What could we do that would make a difference? Well, actually, there are a lot of resources already available. So this is one, for example, this is Clean Air Hub. They do a lot of great work on trying to raise the awareness of air pollution. They've got a lot of resources, a lot of education, a lot of posters that people can download, put up. And this is something which at street level is can make a real difference to people's health. Just as for example, 13% of global asthma is caused by traffic fumes. If we didn't have traffic fumes, we could reduce the amount of asthma by 13%. So we collectively as society are causing some of these illnesses. So that sounds a bit of doom and gloom, but actually there are things that we can do about each of them. But what happens if we as a country met our current climate commitments? This isn't about doing something additional in the future. This is just doing what we've already said that we are going to do. So just roughly, there's between 500,000 and 600,000 deaths in the UK each year. Sometimes it's a bit more, sometimes it's a bit less, but it's thereabouts, just over 500,000. Well, actually, if we met our climate commitments, we could save 125,000 deaths. So this is through changes to our diet, changes to our exercise, and changes to air pollution. If we, as a society, as a nation, agreed to do and put into place the actions that we've already said we're going to do, this is the amount of human health benefit that we could achieve just in this country. This isn't on a national or an international scale. This is just in the UK. So this is from the Lancet. So if I was going to say for people to do one thing, the first I would say is to become carbon literate. Know your enemy, know what we need to do. And the Carbon Literacy Project offer training courses to a whole host of different people. Their contact details are on here. Speak Carbon is a Yorkshire-based training affiliation that does carbon literacy training for people and places and organisations. And there's my contact details as well. So I'm here all afternoon. If people have got questions, please put them in chat. Please